Hey everyone, it's Dr. Erica Person with Flex Audiology, and I am here today with Stella, our resident Pawtologist, which I just woke her up, so she's not really happy. Today we are going to talk about tinnitus retraining therapy and how does it work. Before we get into that, though, take a moment and click the subscribe button or give me a thumbs up. All of that helps to spread awareness about what Flex Audiology and some of the tinnitus therapies that are available to the world. So I definitely appreciate that. So thank you. So our goal today is really just to talk about tinnitus retraining therapy. I'm going to shorten it to TRT just for the interest of time. And how does it work for our brain? So what if your brain could learn to ignore your tinnitus? Just like you ignore the sound of a fan, or let's say you get a new appliance or a clock, and when you first bring it into the house, it drives you nuts. But really after a couple days, the sound's still there, but you don't notice it. You can literally filter it out. And that is exactly what TRT training does for your brain. That's what it's designed to do. So TRT, of course, stands for Tinnitus Retraining Therapy, and it does combine two main components. So the first component is specialized counseling. The goal of this counseling is to change how you feel about the tinnitus, okay? And then the sound therapy portion is designed to reduce the contrast between the tinnitus and the silence in the room. The primary goal of TRT is what we call habituation, and this is aiming to help your brain reclassify the tinnitus as unimportant so that it fades into the background naturally, very similar to what we just talked about with the clock and the fan. So the sound therapy, what that does is it's providing a gentle, constant sound delivered generally through hearing aids or wearable sound generators. I am what we call Trimpa old. I've been in this industry for almost 25 years. And when I first started, we actually had specific devices that were just maskers. And I believe they still make them. But now most of the tinnitus maskers and sound therapy programs, they are incorporated into hearing aids. And so they serve two purposes. One is to treat the hearing loss if you have it, and then also provide the sound therapy. It tends really to be a cheaper option anymore than just doing the tinnitus maskers. And I want to be clear that masking tinnitus is not the goal. So if you have been to a provider that just simply turned on the masking noise, unfortunately, they were well-intentioned, but unfortunately, they probably caused my job to be a little bit more difficult. We do not want to mask tinnitus completely. If you mask it completely, we cannot retrain your brain how to stop focusing on the tinnitus. Our goal is to soften the tinnitus and reduce the contrast between the tinnitus and the complete silence. So that way your brain will reclassify it as unimportant. Okay. It gives your brain something else to focus on, and we use it as a tool to support the retraining process for your brain. The counseling is unique in the fact that you need to understand how the tinnitus is working in your brain. If we can understand it, we can reduce the fear and remove the emotional reactivity to the sound itself, and it really encourages a mind shift away from the threat. It takes the threat of the tinnitus and it moves it into a neutral sound classification. In order for us to reclassify the sound as unimportant, we have to decrease our emotional response to it. So if your tinnitus spikes, or if your tinnitus, maybe it's been really soft for a while and it gets really loud, the more you focus on it, the more your body will tense. And that is a limbic system response. It's a fear response, whether you're classifying it as fear or a threat. But that's what your body is doing. And we have to be able to remove that negative connotation in order to move it to a neutral sound. Now, TRT is not an overnight fix, but it does work. For people that have been properly trained on TRT and are utilizing it appropriately, it does typically take about 12 to 24 months for you to completely habituate and move the sound over to a neutral sound. What does this mean? It means it takes the right person, it requires patience, it requires consistent use of the sound therapy and consistent counseling throughout that time. But over time, that tinnitus will become less noticeable and less distressing for most people. This is where I would implore you to make sure that whoever you're working with is a tinnitus trained audiologist. It's somebody that has gone through specifically TRT training. Ideally, if they got trained by Dr. Jastroboff himself and his wonderful wife, Dr. Jastroboff, it's Jastroboff and Jastroboff. They are wonderful. If they've gone through their training, you know you're in the right place. Those two are looking to retire soon. So whoever picks up their particular program, I know that they are in the process of training their replacement. So just make sure it's not somebody that has learned TRT maybe from a YouTube video. So you want to look at their certifications, because true TRT follows a very structured protocol that involves the sound therapy device fitting, the adjustments, the ongoing counseling sessions, and a personalized treatment plan. And in addition to that, it's going to be critical that you work with an audiologist that follows best practices. So there's also best practices in the tinnitus care space. So what does that mean? It is use of inventory, specific questionnaires that piece out the tinnitus itself. It is matching your tinnitus for pitch and loudness. We want to rule out other tinnitus sound issues such as hyperacusis or misophonia. We want to potentially do biomarker tracking. So what is that? Things that you've already had before. It could be an Apple Watch. It could be a Fitbit. We use our own specific ring here in our clinic. And what are we looking for? We're looking at what is your overall holistic view of your life look at? What are your stress levels? How is your blood pressure? How is your oxygen levels? How are your sleep patterns, your emotional reactivity to stuff? So we want to look at multiple facets of your life, and that is the best practice for a TRT training program. And that's ultimately what is decided that's best for you. So who does TRT work best for? Generally, it's going to be anybody with bothersome or really intrusive tinnitus and who are willing to commit to that program. And it's especially effective for those who are struggling more with the emotional impact of tinnitus. Not necessarily, doesn't have to always just be the volume. It's just how am I reacting to it when it really impacts my life. And then it often works best when you're using it alongside treatments like CBT or hearing aids if you do have hearing loss. So it tends to be an all-encompassing treatment program and kind of like, let's attack the tinnitus from all levels so that way we can move it from a threat to really a non-sequential sound that may or may not be there in your head. So if you don't know what CBT is, that's cognitive behavior therapy. And I do have a video out there that specifically speaks to that in a treatment program that is a nice complement that goes along with TRT. So TRT won't make your tinnitus disappear overnight. It's not a cure. It's just reclassifying the sound from a threat to a non-threat, which really allows your brain just to tune it out. Most of the day, I can go along and I don't even notice I have my tinnitus. And now that I'm talking about it and I'm doing a video about it, it's just kind of slightly there. It's always in the back. It's one of the beauties of having Stella come to work with me on those days because it helps decrease my stress level. So make sure you're working with a provider that has been trained in tinnitus. And if they're going to do TRT, make sure they've specifically been trained in TRT protocol and are using tracking tools to help hopefully shorten that time frame from 12 to 18 months, maybe down a little bit less than that. There's some really powerful management strategies that are out there. So hopefully, again, you subscribed or liked the button so that way you will get notified of any of our new and upcoming treatment options for tinnitus or any information that we can put out about it. Till that next video, thanks and have a great day.